Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. Lagos State Commissioner for Health tests positive for COVID-19. Nigeria crosses the grim milestone of 1,000 COVID-19 deaths as infections continue to rise. And just when New Zealanders were looking forward to the end of a 2-week lockdown, the government announces an extension with new measures. Thank you for joining us on the program. Now, being at the forefront of the fight against COVID-19 comes with its hazards, and one of them is having a higher probability of contracting the virus. Well, after several months of battling to save lives and prevent infections in Nigeria's epicenter of COVID-19, the Lagos State Commissioner for Health, Professor Akin Abayomi, has tested positive for the virus. Professor Abayomi confirmed his status in a tweet from his official handle, saying, "With utmost sense of responsibility, I am obliged to make it known to the general public that I have tested positive for COVID-19. Consequently, I have proceeded on a 14-day self-isolation and treatment at home." Another statement from the Commissioner for Information and Strategy, Mr. Gbenga Omotosho, says Professor Abayomi reportedly became aware of his status following the required testing protocol of contact tracing procedures. The bright spot, however, is that he is asymptomatic and doing well. He will continue to discharge his duties both as the Deputy Incident Commander of the Incident Command System for COVID-19 and as the Commissioner for Health. 1,002 people have died from COVID-19 in Nigeria, a grim reminder of the dangers posed by the novel coronavirus. Total confirmed cases also continue to rise according to latest figures from the Nigeria Center for Disease Control, with 322 new cases across 17 states and the FCT. The nation has now recorded 52,227 COVID-19 cases, 38,945 discharges, while 12,280 cases are said to remain active. As a breakdown of the latest cases, with Lagos recording 130, Bauchi 36, FCT 25, Edo 17, Bayelsa, Ogun and Oyo 14 each, Anambra 13, Kaduna 12, Ondo 11, Abia 10, Osun 6, Plateau and Kwara 5, Kano 4, Ebonyi 3, Sokoto 2, and Borno 1. Well, let's head over to Benin State, where the Chief Medical Director of the State University Teaching Hospital, Professor Terlurum Swende, is calling for sustained investment in the health sector, as done in the past 6 months by government at all levels, to improve the capacity of Nigerian health system and workers for effective service delivery. Professor Swende made this call while speaking to Channels Television on the successful management of nearly 200 COVID-19 patients since the arrival of the pandemic in the state on March the 27th, noting that his team has been one of the good examples of a functional team. The total confirmed cases of COVID-19 in Benin State stands at 430, with less than 10 casualties recorded from the 2 main isolation centers at the Benin State University Teaching Hospital, Makurdi, and the Federal Medical Center, Makurdi.
We have over 400 confirmed cases in Benue. However, we've received and managed 156 of them here at the Teaching Hospital Isolation Center. Of these, we have successfully treated and sent home in good condition 130 of them. We have 19 active cases as we speak being managed behind us. Unfortunately, we had 6 mortalities here and 1 patient was referred out. That has been in terms of statistics. Again, what we witness here is not different from what we are seeing elsewhere. The vast majority of patients that are coming with mild disease, as they have no symptoms or mild symptoms, and invariably they get to do well. A few of them come in with a great respiratory challenge, in fact, some in failure. We'll be able to win the battle with some, and in 6 instances, we were not able to.
Let's head over to Cross River State, where the government is asking residents to keep adhering to all COVID-19 protocols as directed by the NCDC to contain the spread of COVID-19 as the number of cases in the state continue to rise. Speaking in Calabar, the Cross River State capital, the Commissioner for Health and Chairman COVID-19 Task Force, Dr. Betta Aidu, said the state has not stopped doing what it was doing before to keep the state free of COVID-19. She attributed the increased number to the opening of interstate borders as the influx of people into the state through air and land borders keep increasing. The Commissioner, however, charged all Cross Riverians and its guests to continue adhering to all the COVID-19 protocols to contain the pandemic.
The state has not stopped doing what we used to do before now. In fact, we are doing even more than we used to do before now, engaging at all levels, engaging transporters, doing training for health workers, expanding our horizon, improving on surveillance, contact tracing, and indeed carrying out community sampling for COVID-19. We're doing a lot of work in communities right now, so we're doing even more than we used to do before. The risk communication pillar, which sends out the information and promotes health, has been up and doing. They've been in several local government areas, and we've had a buy-in from both the Christian Association of Nigeria, of course, the local government chairman, amongst others. However, we've told our people to continue to do what is right to protect themselves. Use your face masks always in public places. And like I would put, if you have friends coming over to visit you at home, please use your face masks. Leave nothing to chance. It's also important for them to know, or Cross Riverians, to continue to wash their hands, often use their hand sanitizers as much as possible. Easing of the lockdown does not in any way mean that the country is completely free of the virus. Positivity rate in the country is still above 10%, and Nigerians need to collaborate to see how we can bring this down below 10%.
So let's get an update on Nigeria's vaccine plans. And joining us this afternoon is Dr. Adeshino Adega, the Director of the Center for Research and Innovation. He's also the head of the Department of Biological Sciences, Mount Etop University. Good afternoon. Thank you for joining us. You know, I'd like to pick it up from that conversation we had just before we started the program. And it appears as though a lot of people are asking, when would this end? How far into this journey are we? How many months do we have to go? Really, is there an answer to that question?
For the emergence of vaccine, or for the management of the situation?
In the fight generally, is there an answer to, okay, this is how long we have to go, or people just need to take it one step at a time?
Take one step at a time, because the nature of the virus is such that it mutates.
Right.
What we have in 2002 is different from what we have in 2012. Now, what we have in 2012 is different from what we have in 2019. And in 2019, we are battling with right now. So, we look at the nature of the whole thing is that we find that the emergence of vaccine will play the game.
Okay.
Yes.
So let's talk about that, since, I mean, that's going to form a major part of our conversation. So I understand there's a vaccine being developed in Nigeria, or there are plans about that. What is the situation, really?
The situation is that Nigeria is moving, and Nigerian universities, they are not relaxing. The Nigerian universities is cooperating or collaborating with Oxford, with Cambridge. Right. And it was announced by the National University Commission that they are already on it. And what the demand is doing is such that it's really sequencing the gene of the virus that could be very, very effective. And that's why maybe they are playing on a separate collaboration with Cambridge, so that whatever they are having as their own products will be more effective. Right now, Cambridge, Oxford is also producing vaccine now. And they are trying. They are already planning phase 3 trials. Because in vaccine trials, we have phase 1, phase 2, phase 3. Now, most of the organizations producing vaccine now, they are in either phase 1 or phase 2. A few of them are in phase 3. And phase 3 is very important. Important in the sense that they are looking at the safety of the people, the efficacy of the vaccine.
In the first place.
Is it really going to protect against the virus? That's the efficacy.
Right.
Then the safety of people, that what are the side effects of people that are going to get the vaccine? in the trial, they get some signs. And that sign, they need to know, is it just on single or individual signs, or when they roll out the vaccine in multitudes, those side effects will be so magnified.
Right.
So those are the precautions you need to take in vaccines. And then even the vaccine itself, I found that in some people, it's going to prevent them from acquiring the infection. And in some people, it's going to prevent the precipitation of the disease. Because one is to acquire an infection and can fizzle out on its own.
Right.
And the other one is that when the virus gets to the body, it now degenerates into the body and precipitate disease.
So clearly, this is not an
which
overnight
one is that vaccine is actually taken care of. So that's why phase 3 and phase 4 very key.
You just ruled out the extensive nature of development of a vaccine.
Exactly.
And one critical point is human trials.
Exactly.
Now, if you've had to share questionnaires in Nigeria, you know how difficult it is to get people to fill questionnaires in the first place. Talk more of getting people to participate in human trials for a vaccine. So what's the plan, really?
There are two ways of engaging.
Right.
One, the first thing, the Minister of Health of the state or local government, they need to propagate the information about the vaccine, telling them the benefits of the vaccine, and the benefits now and in the long run, especially in the elderly. That's very, very important. And once people get to know that, then they will now be able to engage and say, okay, let me have a trial. But if there is no information, about the vaccine, people will just be hesitating. Because already they are having a mindset.
Right.
Oh, I don't want a vaccine. They are telling us not to get the vaccine. No, it's not like that. Not like that. Because I said the vaccine is here, and it's going to take a long time, provided if it's the one we're having now is the end of the mutation, fine. With the vaccine, fine. Even if it's not the one, go to mutate further, then the essential of the vaccine is very, very key, because it can prevent any other one that is coming on after the virus.
So in essence, you're saying to Nigerians that it is safe to participate in vaccine trials.
Exactly. And that's why I'm happy that Redeemer University is taking that step to take a step of producing one in collaboration with UK, UK University in UK.
So you started by telling us that Nigeria is involved in vaccine development, which is, good news, really, in this fight against COVID-19.
Exactly.
Now, you've encouraged people to participate in human trials when that happens. But people are asking, so which is achievable in the shortest possible time? So there's vaccine, which is prevention, and there's treatment, which is getting drugs. Which should we really look forward to achieving in the shortest possible time?
There are vaccines Nigeria has signed the MOU to collaborate with, and they are getting those vaccines in now. Advise that you can take it as long as NAFDAC must have confirmed the efficacy and the safety of those vaccines. It's okay. Now the treatment can still go ahead, because it is very, very important especially in the elderly.
Yeah.
In the elderly, they are very, very vulnerable.
Susceptible to this.
So it's still very, very good to continue the treatment. And then taking the common nutrient intake that can prevent the severity of the vaccine.
Let me see if I can squeeze this in quickly.
Sorry?
Let me see if I can squeeze this question in, because I know that you were involved in the advancement of fast immunodiagnosis of Mycobacterium tuberculosis, basically saying that, let's test faster. Is that something we can also look into for COVID-19?
Right now, the Nigerian Institute of Medical Research developed the PCR, the molecular techniques of detecting the virus.
Can we do it faster? Is that a possibility?
Well, because it takes a long time, not as easy as that.
I understand. We'd like to thank you so much, Dr. Adeshina Adega, Director of the Center for Research and Innovation. Thank you so much for sharing your time with us.
All right.
Well, just in case you were thinking lockdowns are a thing of the past, we'll bring you the story of New Zealand after the break. Please stay with us. You're welcome back. Let's head over to Ogun State, where 14 new cases of coronavirus have been recorded in 3 local government areas of the state, bringing the total number to 1,624 since the index case of the pandemic was reported in February. About 1,410 patients have been discharged, 17 currently on admission at the Olabisi Onabanjo Teaching Hospital, Shagamu, and the Federal Medical Center, Idiaba, Abeokuta, which is in the state capital, while 26 fatalities have been recorded in the state. As a result of this, measures have been put in place by the state governments to hold community spread and flatten the curve of the pandemic. But despite these measures, attitudes of the residents towards obeying these basic directives aimed at halting community transmission and flattening the curve has remained a huge task.
People are taking things for granted, believing that life has returned back to normal, not taking into cognizance the need to abide by the guidelines to keep social distance or physical distancing, and to also maintain personal hygiene at the topmost level. And so also, people are actually not taking responsibility. To some, they still feel that it is a scam. It doesn't exist, or it only exists with the political class, or it does not even. It is not near us, or our immunity is capable of sending it away. So we have so many many thoughts. So I think to flatten the curve the more, it is for us to encourage critical stakeholders like the religious organization, even the market association, and those who engage in day-to-day management of crowd.
There is a need to step up the continuous COVID-19 awareness and sensitization, as compliance level in some areas is still not enough. The transport hub, especially in motor parks, is one major sector the federal government wants strict compliance, being a convergence point for people from different parts of the country. Our Imo State correspondent went round some motor parks in Owerri and brings us this report.
The coronavirus pandemic has no doubt affected productivity in most sectors of the economy. The transport sector is one of the worst hit, especially during the lockdown. But when the federal government lifted ban on interstate travels, there are some COVID-19 protocols transporters and commuters need to adhere to contain the spread of the virus. Such protocols are mandatory use of face masks, the use of hand sanitizers, and reduction of passengers in the vehicles. We went round some interstate motor parks in Owerri, the Imo State capital, earlier today to check the level of compliance of transporters to these protocols, and to a large extent, it's quite commendable.
I can carry 14 passengers, we're giving them 7 passengers instead of 14. And the face mask, we are sharing face masks. You can see the one I'm putting on. It's mostly face mask. So all our passengers, we are dashing them face mask, not even to pay. So we know that health is very, very important, and everybody believes that yes, COVID-19 is existing. So whatever government says is exactly what we'll do.
Before you enter the office to get your ticket, we have our pocket there. You wash your hands. We give you hand sanitizer. Before you enter the office, we check you to know the temperature of the passenger that is coming to board the vehicle.
Officials of the COVID-19 task force also share their thoughts on their enforcement plan on these COVID-19 protocols, especially at public places and motor parks.
We have engaged the churches, the town unions, the NURTW, these people that has to do with transportation. We have engaged market leaders. In fact, we have touched every nook and cranny of the society to encourage them not to encourage this community transmission, even though it hasn't been easy. And we're not using force. Our own approach here is advocacy.
From Owerri, the Imo State capital, Eyitope Kuteyi for COVID-19 update.
Well, Dr. Sebastian Oku is a state coordinator at WHO in Imo. He joins us via Skype this afternoon. Well, great to have you on the program. We've seen that the WHO continues to hold briefings and train health workers. In fact, earlier today, a briefing was held, and one of the main issues that came up is talk about compliance amongst people. And the question is, what more do we need to do?
Okay, thank you very much. Can you hear me?
Yeah, please go ahead. I can hear you.
Okay, thank you very much. Yes, compliance is a major plank of the control of the pandemic. And the reason why we have to continue to do continuous sensitization and training is that we cannot have enough of community mobilization. Risk communication is very, very important. It's very, very key, particularly where you have people within the communities, within the society, who don't believe that there is COVID-19. So we have to continue to engage them at the community level. We have to continue to engage them at the motor parks, wherever that we may find them, so that they would know what measures are recommended for them to help to flatten the curve of the pandemic.
Right. Let me see if I can also get your thoughts as we look forward to reopening Nigeria's airspace to international flights. There's been a lot of talk, a lot of debate. We've seen what has happened in other countries as a result of opening the Air Force, or rather the airline, I should say. What should we be looking to? What are the areas we should be focusing on right now?
Well, we should be focusing on safety of passengers, safety of workers. We should be focusing on maintaining the level where we are in Nigeria as to the number of cases that we have, and actually reducing the number of cases that we have. So opening up the airspace for international travel requires a risk analysis, which I'm sure the Minister of Aviation has done in conjunction with the NCDC and the Presidential Task Force on COVID-19. So the risks are there, and I'm sure that they have assessed those risks and feel that Nigeria is safe enough to be able to resume international flights. We should be able to have the capacity, to detect cases that may come into the country from abroad and be able to manage and trace those cases. So the safety of passengers, safety of health workers, safety of airline workers is paramount in considering whether to reopen the international flights or not.
Well, Dr. Sebastian Oku, I'd like to thank you so much for those thoughts on the program. He's a state coordinator of the WHO in Imo. Thank you for your time.
Thank you very much for having me.
Well, there have been fears of a resurgence of COVID-19 in Europe for a while now, and the latest figures from France and Italy over the weekend have left many worried. France reported more than 4,800 new infections over the previous 24 hours, the highest daily numbers since May. Meanwhile, Italy, once the epicenter of the pandemic, is also seeing its highest rise in cases since May, with 1,210 new cases on Sunday and 1,071 on Saturday.
Until at least midnight on Sunday, adding that COVID-19 is a hard reality to accept. New Zealand has had success.
We'll take a look at our website. That's channelstv.com, where you can find the latest updates on the pandemic. And all you need to do is log on and access the news in health, politics, business, sports, and many more. And like this story, US approves plasma to treat COVID-19, global death toll above 800,000. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu. Do stay safe.